Hey, welcome to The Explainer. Today, we are diving deep into the modern way to manage pain. And let me tell you, it's a journey that involves so much more than just a prescription.
Ever wonder about that? Why does some pain just disappear while other pain sticks around for, well, a lifetime? It's a huge question, right? And it turns out the answer isn't just physical. More and more, we're realizing it often all starts in the mind.
All right, so let's get right into it.
The very first step in managing pain today isn't what you might think. It's not about treatment, it's actually about prediction. It's all about figuring out who's most at risk for that pain becoming a chronic thing right from the get-go.
So doctors and therapists are trained to spot what they call yellow flags. You can think of them like little warning signs, right? They signal that a patient might need a lot more support to make sure a short-term injury doesn't morph into a lifelong battle with pain.
Okay, so you see this list, all these things are factors for sure, but here's what's really fascinating. The data shows that anxiety, just plain old anxiety, is the #1 biggest predictor that your back pain will turn into a chronic problem. It's just incredible, right? It really drives home how connected our minds and bodies are when it comes to healing.
Okay, we've got the risk factors down, but what's next? Well, it's the diagnosis, and believe me, this part is way more complex than just getting an MRI and calling it a day.
This is so important. You see that quote? It's what doctors call the MRI paradox. So you get your scan back and it shows a bulging disc and you think, aha, that's the problem. But maybe not. For a lot of older folks, stuff like that is totally normal. It's basically the equivalent of getting gray hair. The real source of the pain might be something else entirely, which is why a hands-on exam by a good doctor is just so critical. And check this out. This really shows why getting that diagnosis right matters so much. Are we talking about a burning pain? Or is it more of a numbness? Are you feeling unsteady on your feet? Or does even the touch of your shirt cause pain? See, the answers to these questions point to totally different kinds of nerve issues, and you can't treat them the same way. You just can't.
Okay, so this is what it's all building towards, the solutions. The modern treatment toolkit for pain is, well, it's huge now. And it goes so far beyond just reaching for a pill bottle.
The first line of defense is often just movement. I know, it sounds completely backward, right? When you're hurting, the last thing you want to do is move. But for so many conditions, the best medicine isn't a pill at all. It's a plan to get active. Lying in bed, that can actually be the worst thing you can do.
And here's why this is so important. You have to build this foundation of care that doesn't involve drugs. That's the key to winning in the long run. Whether you're doing aquatic therapy to take the stress off your joints or maybe some Tai Chi for your back, the main goal is always the same: get your body functioning better first.
So, you can see there's a really logical progression here. It's a step-by-step approach. You always start with the simplest and safest things first. Stay active, maybe take some over-the-counter anti-inflammatories, and you only climb that ladder to stronger meds if, and only if, those first steps aren't cutting. All right, now we need to talk about opioids. If they really are necessary, what's the game plan? How do doctors manage the very real, very significant risks?
And here's something you might not know. The biggest danger isn't always the opioid itself. Sometimes the real hidden danger is lurking right there in your medicine cabinet. It's all about how that opioid interacts with other common drugs you're taking.
So what in the world is a CYP3A4 inhibitor? The easiest way to think about it is like a traffic jam in your liver. It literally puts the brakes on your body's ability to break down and clear out a drug. So what happens? The drug just builds up and up and up to really dangerous, sometimes even toxic levels.
And this right here is a perfect and frankly terrifying example. Imagine someone is on a fentanyl patch for their pain. Then they get a simple infection and their doctor prescribes a super common antibiotic, clarithromycin. That combination can cause the fentanyl levels in their body to skyrocket, leading to a potentially fatal overdose. This is exactly why you have to tell your doctor every single thing you are taking, every pill, every supplement, no exception.
So, where do we go from here? Let's talk about the path forward. For people who do develop opioid use disorder, what does recovery actually look like? What does harm reduction mean? This is probably one of the most important points we'll make today. We have to change how we think about this treatment. This idea that maintenance therapy is just trading one addiction for another, it's just plain wrong. Medications like buprenorphine are life-saving treatments. They're not a crutch. They work on a biological level to stabilize brain chemistry, cut down cravings, and let someone get back to living a normal life. Okay, everyone listen up. If you remember only one thing from our time together, please make it this. Knowing the difference between withdrawal and an overdose can literally save someone's life. Withdrawal is awful, no doubt about it. You'll see agitation, goosebumps, big dilated pupils. But an overdose, that is a life or death medical emergency. The signs are different. Tiny pinpoint pupils, really shallow breathing, and they're unresponsive. If you see that, you call for help immediately. And if you have naloxone, you use it. No hesitation.
So in the end, what does this all come down to? Managing pain isn't just about the science, it's about humanity. It means looking at the whole person, not just their physical symptoms, but what's going on in their head, in their life. The more we understand this whole complex journey, the better we can all be at advocating for care that's not just effective, but safe and truly compassionate.